So welcome, Dr. Glover, and thank you for joining us today.
Thank you so much for having me.
You're welcome. Well, Gina Glover is a postdoctoral associate with the Socio-Technical Systems Research Center, SSRC, at the Massachusetts Institute of Technology. She's a member of the team working with the military health system to assess and make strategic and operational improvement recommendations for the psychological healthcare system for service members and their families. So thank you for joining us, and I'm just going to pull up your slides right now, so please stand by. All right, so on the screen I have Dr. Glover's presentation. We're looking at the first title slide, Critical Factors for Sustaining Kaizen Event Outcomes. Dr. Glover, I'm going to hand it over to you now, and just let me know, when to advance.
Thank you so much, Shiragi, and thank you, everyone, for joining us. I'm very excited to be able to share with you all some of the research that I've been doing in different settings, some in healthcare, some in manufacturing organizations, around Kaizen events. And my understanding is at the VA, they're known as rapid process improvement workshops. In some other settings, they're called accelerated improvement workshops, sometimes Kaizen Blitz, sometimes mini Kaizen, hence the first slide. So we'll be talking about all of those and describing some characteristics, and I think more importantly to highlight some factors that have been found through my research and others that can really help us in sustaining the outcomes from those Kaizen events. Next slide. So the next slide, slide 2, just describes the agenda for the day, or for our hour together. So I'll start by just describing Kaizen events, or RPIWs, and then we'll spend some time discussing how initial results can be achieved, what critical success factors have been found in achieving initial results. Specifically, I'll present a case study of a 5S event that was done in a hospital operating room setting. And then we'll move into how do we sustain those results. So we find that while organizations tend to be able to achieve initial success, it's long-term success that can be quite difficult. So I'll discuss some of our findings from a data set of about 65 Kaizen events, and then we will just spend some time with conclusions and future research. Shiragi, if you click one more time, we should still be on slide 2, but you'll notice an icon that says things to do. So throughout this presentation, there are opportunities for everyone to think about an RPIW that maybe you have been a part of, that you have sponsored, and to answer some questions about that RPIW, just so we can keep it interactive throughout. Most of the work that I'll be presenting was based on my dissertation work, which was done at Virginia Tech, but in conjunction with Oregon State University and Texas Tech University as a part of an NSF-sponsored project. We can move to slide 3.
Okay.
And as Shiragi said, unfortunately, I cannot see if people have questions. But if you do, Shiragi, please just feel free to stop me, and we can answer questions along the way. So slide 3 is just a quick refresher. Kaizen events, or RPIWs, are traditionally conducted within the context of Lean and the Lean philosophy. So we want to spend just a little bit of time reviewing that. Of course, Lean is definitely known for what we sometimes refer to as the hard side, the technical side. So how do we maximize value in terms of how we're using a myriad of resources, so materials, labor, time, space, etc. But there's also the softer side of Lean, and the work that I'll be presenting really emphasizes that side as well. So not only are we concerned about, for example, measuring waiting times and making sure those are shorter, but making sure that we're developing a spirit of continuous improvement and respect for people. And of course, the VERC has been doing this type of work for quite some time. So if you click again, Shiragi, we should still be on slide 3, highlighting the technical system outcomes and social system outcomes. So in the work that we've been conducting, we've not only, again, been concerned about what technical system outcomes can we achieve, such as productivity, improved quality, et cetera, but a set of social system outcomes as well. So with activities like RPIWs, are we experiencing an increased appreciation and enthusiasm for lean? Are work area employees more likely to participate in improvement efforts? Are we improving teamwork, et cetera? So we'll use a combination of these types of technical system outcomes and social system outcomes throughout the work. Next slide. So you can go ahead, Shiragi, and bring up everything on this slide, on slide 4. Yep. So I always like to just spend a little bit of time positioning ourselves within the real-world context. So we know that we have these RPIWs or Kaizen events that we can conduct, but they're not only conducted within the setting of healthcare, right? So the example that I have here and that we'll be talking about a little later is some work that I've done in HCA, specifically the Montgomery Regional Hospital, so Healthcare Corporation of America. And so in that setting, the question was, how can we decrease the turnaround time between surgical cases? But in the manufacturing setting, Dana is a motor and parts manufacturer that focuses on productivity by 30%. So there are a lot of papers that group has put out about the Kaizen events that they've conducted. And Amazon.com actually uses RPIWs to improve their environmental and energy initiatives. So one example is their packaging. They did a series of RPIWs using cross-functional teams to reduce the amount of materials that they were using in their packaging. So RPIWs and Kaizen events can be used to solve a variety of problems. Slide 5, please. So let's just spend a little bit of time on the definition, not to belabor the point, but just to make sure that we are all on the same page about what a Kaizen event is. So traditionally, they're described as focused and structured improvement projects that use cross-functional teams to improve a targeted work area. They tend to have very specific goals and use an accelerated time frame. So when we say accelerated, traditionally the time frame is 3 to 5 days, but in a healthcare setting, you can often see 1 to 2 day events, sometimes over the weekend. A colleague of mine in Ohio, Dr. Wang, is experimenting with half days, so 3 days, but just for a half day. And that's tended to work in some hospitals as well because, of course, a lot of times we cannot expect the staff to take off that much time. In the Kaizen event that I'll be describing to you, we actually decided the staff was willing and so motivated that they actually came in on the weekend. A lot of people weren't necessarily working that day. And it was a football game. So if anyone knows anything about Virginia Tech in that area, it was quite remarkable that people were so excited to take off from their football game to join us. Highly focused, so because we only have a short amount of time, we definitely want a well-defined problem. We focus on creativity before capital, so before making any major capital injections, we really want the staff to think outside of the box. Very team and action-oriented. The saying, go to the Gemba, so go to where the problem is, make observations, and make changes as you go along. We definitely want to have verifiable metrics to know whether or not we've achieved the goals that we have, and that really makes a huge difference once we start talking about sustainability. And they're repetitive, so you can use an RPIW, as some of you probably have, within the same work area multiple times. You can deploy them across very large organizations, and so we'll talk about some of those characteristics as well. You can go ahead to slide 6, and you can bring up everything on slide 6, Shiragi. The other thing that's interesting, I think, about RPIWs is that we can also use them at different levels of an enterprise and in different contexts. So while it is probably most commonly used that we're focusing, for example, on one department, let's say the emergency department, Because they bring together cross-functional teams, you could also use an RPIW across a hospital. So you could put together a cross-functional team across a hospital setting and make improvements that way. We've also seen, while not in a healthcare setting, some RPIWs that were done even across a region. So bringing together people that were from, this was actually in a finance setting, so people that were from different branches of this very well-known bank to come together to solve problems that were common to all of those involved. So again, they can be used at different levels and in different contexts in terms of industries, different national cultures. There was a recent large-scale effort in United Arab Emirates that used a competition. So they actually provided some funding and did a nationwide RPIW competition to try to increase innovation and get people excited about continuous improvement. Slide 7, please.
Yep.
So after that, after we kind of have a sense of what Kaizen events are, I just want to spend a little bit of time emphasizing how important measurement can be in achieving initial and long-term success. So throughout the presentation, you'll see measures that are more technical in nature and more related to the social system. And we do that because there is increasing evidence that when organizations achieve some type of performance success, they're using some type of framework that provides to them not only technical performance measurement tools to use, but also related to their human resources as well. So we'll discuss some of the benefits for the technical system outcomes and social system outcomes. Okay, that brings us to slide number 8 and our first activity. So the first thing that we would like to do is just for everyone to think about an RPIW, Kaizen event, Kaizen Blitz that you've been a part of. And throughout the presentation, I'd like you to think about this particular event and the role that you held on that team. So if you were a champion or sponsor, think about your role as a champion or sponsor, manager, if you were a frontline worker, an improvement team member, end user, etc. So we'll just take a pause. And if you're actually in a room with your team, it's great to kind of talk about this as a team. Perhaps you can pick the same RPIW and spend some time discussing it as we go along. So I'll just give everyone about 20 seconds or so. And perhaps if you are on live meeting and you've chosen an RPIW of interest that you would like to reflect on, and you could perhaps say it in the notes, or I don't know if there's a raising hand function, but maybe we can just hear a couple of them. Has anyone shared? We'd like at least one person to share. Any takers? Shiragi, do we have any online entries?
No, I don't see any.
Okay. Well, perhaps, have you participated in an RPIW?
This is Gauri.
Oh, great.
Regina, I think there's a problem joining in the online meeting. So I've been on the phone, but I don't have access to join the meeting. I don't know if you all are seeing anybody logged in at the other end.
Oh yeah, we are. I see about 80 or so folks on, probably 40. But let's definitely touch base afterwards.
Okay,
I didn't realize that you were having
then I'll be
trouble
on the phone. Okay.
Well, Gowri, since I know that you're on the line, and thank you so much for joining us, perhaps you can just give us an example of an RPIW or Kaizen event that you've been a part of, just so everyone can hear just one example before we move forward. We definitely want this to be as interactive as a webinar could possibly be.
Okay, since I jumped on the phone, I'm happy to share one.
Thank you.
This was in Melbourne in a public health hospital, and the major big project we were really working on was reducing waiting queues in the outpatient department. But the Kaizen event was basically for realigning and rearranging the way the reception desk was set up, because there were like 6 receptionists when a patient came in. However, none of those receptionists were set up in a way for particular outpatient departments. They were just general check-ins. So when a patient came in, whether they were looking at visiting a cardiologist or rheumatologist, it didn't matter. It was just, they just had to queue up behind all the patients. So this was a pretty laborious process, and so the Kaizen event was about reconsidering how this could be arranged and how efficient it could be made.
Okay. Were you able to have a relatively heterogeneous team in terms of its cross-functionality, so people from different parts of the process were able to participate?
Oh, yes. It was interesting. We had the administration staff, which is, of course, the receptionist, the director, who was the manager, the nurse manager. We had all the nurses engaged in the process because it really affected the nurses at the back end who would see the patients. And then we did get involvement from some of the providers, like from the some of the departments which really had a problem, like cardiology, rheumatology. So we did have those providers as well.
Okay, fantastic. So, and your role on that team was just as an improvement team member?
Yes, there were 3 of us who were working on the improvement process. And I have to be honest, at that point, I was not very knowledgeable about quality improvement, so this is one of my first 2 or 3 projects that I was working on.
Oh, great. Oh, great. Well, the example that I'll give is one of the first ones that I worked on as well. So so it's always nice to kind of reflect back on what we've learned over time about the success of RPIWs. So thank you so much for sharing. Shiragi, we can move to slide 9 now. So now that we've had some time of just talking about the background of RPIWs, what they are, how they can be used, and everyone is thinking about an example, we'd like to move on, and I'll describe just a case study to you. So this was a Kaizen event that was conducted in an operating room, a part of a larger continuous improvement project to reduce the turnaround time between surgical cases within an OR, and we were also working to improve our FCS, or our first case starts, so the first case of the day starting on time. So one very small part of that larger initiative was to conduct a Kaizen event, and we decided to, yes. Okay, we'll continue. So we decided to focus this effort on eliminating unnecessary items, reducing storage space, and improving workflow. So in order to do this, we started with a 5S Kaizen event, which is oftentimes a great place to start because everyone can be involved. It doesn't necessarily take a lot of the analytical skills necessarily to conduct. We had a great team of undergraduates that were working with us to do some data collection before the event, so we had some spaghetti diagrams that showed us some of the patterns of collecting items, so we had a better sense before going into the Kaizen event of what improvements we could possibly make. Most of the people that participated were also a part of this larger continuous improvement initiative, so they were definitely bought into the idea and actually really felt ownership of the Kaizen event and what happened during the event. So again, we decided to just hold it a Friday to a Saturday, so it was definitely a shortened time frame, and I just served as one of the observers. I also did some training for the team before we got started. So to slide 10, just in case anyone is not familiar with a 5S, it is basically a very simple but highly effective set of techniques to remove waste through the work in a work environment to really help with better workplace organization, visual communication, etc. Usually the 5S, they're technically Japanese words, but one translation is sort, straighten, shine, standardize, and sustain. So that was the process. We really started with sorting items that were in the OR. There were several ORs, but 2 were only being used for storage. So one thing that management, and specifically the COO, was very concerned about was how can we free up this OR to actually be used. So that was definitely a focus. And how can we make sure that we have a location for our more costly pieces of equipment before investing in buying another one? Sometimes there was just an example where a piece of equipment was just out of place and another group needed it. So how can we really standardize where we're putting items and really identifying methods that everyone knows about so that it's clear across the OR. So I'll move on to slide 11. You can see some of our before and after pictures. So we wanted to, again, reduce the storage footprint. So we wanted to remove some unnecessary equipment and provide some visual cues so that people would know where items were. So this is actually OR room 4, and you can see the before is on the left and the after is on the right. So you can see that it would be very difficult to know where anything was in the room if you weren't the person that last put it there. So really by providing some visual cues on the floor, using tape, etc., we were able to at least provide people with a way of identifying where items were. And ideally, they would eventually clear this room completely out as we were able to free up space in the traditional storage rooms where items were expected to be. So moving on to slide 12, the team was successful in reducing the footprint of where items were. There was about a 38% reduction. They were able to remove equipment and carts from visible spaces, which was a complaint of patients. And they were able to see some credit in savings. So some items were able to be returned to the warehouse. Other items that were overstock that could be used up, some implants that could be sent to some of the other facilities, and some other products that were able to be donated. But of course, this wasn't, while they were able to see success in all of the metrics that we had identified before the event, this wasn't kind of the ultimate goal. So the ultimate goal was to clear out that room, and that is why, and is a good example of how Kaizen events can be used repetitively. So while we weren't able to achieve complete success the first time around, we could definitely go back again and continue. So moving to slide 14, I just wanted to take a moment for everyone to answer a few questions regarding initial success. So in a study of actually my advisor, Jennifer Ferris, who is at Texas Tech University, she found in a study of 51 Kaizen events that were not in a hospital setting that a variety of factors, including team autonomy and action orientation that we spoke about a little bit earlier, were critical success factors of achieving initial success. So these are the questions that were used in the questionnaire that we provided to the teams before the event and after the event to have a sense of the extent to which their teams were action-oriented and the extent to which their teams felt autonomy, so freedom in determining changes and making changes during the Kaizen event. So one thing that we can do as an activity is for everyone to just answer these questions. So I have the bullets there, and we'll take just a minute for everyone to reflect on these questions and answer them. And if anyone would like to share their response or just their observations in general on team autonomy or action orientation, feel free to do so.
Well, Gina, I might give an example from a non-VA hospital where I worked before I was here at the VA, but I know that, you know, at the beginning of this particular RPIW, which focused on primary care clinic operations, the leadership said to us that, you know, you have the freedom to be able to make changes, and that we, you know, we expect that you'll have recommendations and we will accept them. So I thought that that was, you know, that's a very important aspect to the RPIW for the team to feel that way. And one of the things they wanted to do was cut a door in half so that people could, I think, move things from the outside to the inside without having to go around and go in that, you know, that door. And they did do that right after the RPIW. That was one of the recommendations. I think that made the team feel that they had really succeeded there.
That's fantastic. And perhaps even, I don't know how long you were there after that event, but did it encourage future improvements as well?
That I can't really speak to. Yeah.
That's a great example of team autonomy. Thanks so much, Janice, for sharing. And I think what's interesting, and I pointed these two out compared to some of the other factors that were important for initial success. One of the other factors was goal difficulty. So the more difficult that the goal was, the less likely the team was to achieve initial success, which makes sense. But that's more related to the event itself, right? So technically what needed to happen during the event. And I wanted to highlight these two because they are more related to the social system. Is the team feeling as though they're supported and have enough freedom? Another factor that was important was management support. So did the team perceive that management was supportive of the event in terms of providing them enough human resources and financial resources and time to achieve what they felt needed to be achieved? And then, of course, action orientation is more related to the process of just the Kaizen event or RPIW itself. So spending enough time in the work area as necessary. So those were just two factors, but moving, if you advance to slide 15, and definitely where we want to spend more time today, is how do we sustain results? So in this example, the team chose to implement a 5S audit tool. So we were able to develop this tool in part from the research instruments that we had developed over time. There was also an effort to just maintain management support and employee learning, so we did a few other training modules with the group, and they were able to sustain the results. At least we tracked it for about a year. And it was a change that was very visible because it was a 5S change. You could clearly see that people were attempting to make improvements in the area. There were very clear goals, and there was very strong leadership commitment. I think it perhaps is rare for a COO, although this was a smaller hospital, to come to a report out, but he was always there, and so I think that really spoke volumes to the staff in terms of the level of support that they had. However, there are definitely challenges with sustaining Kaizen events or RPIWs in different settings. Some report difficulty in sustaining even 50% of initial outcomes. So how can we do better? Moving on to slide 16, the issue of sustaining changes is not just an issue for Kaizen events or RPIWs, but it's something that we see throughout the change literature. So some of the older studies on the topic that focus on the institutionalization of change in the top figure done by Goodman and Dean in 1980 and 1982 really focused on the role that the structure of the change itself had, the organizational characteristics, and then how that impacts processes to eventually impact performance. There have been, of course, studies of total quality management and continuous process improvement and lean more generally that also argue that sustainability can be difficult. And there are some consequences of not sustaining improvement. In a study by Bateman and Rich for UK automotive manufacturers, they specifically found that when a team was not able to sustain outcomes, that definitely limited the ability for that work area to do future improvements or to use Kaizen events in the future. People were less likely to buy into the idea. And then there are just some limitations that we see in the literature. So specific to Kaizen events, because they are so practitioner-driven, which makes them, fantastic, and we have a lot of case studies and trade press about them, there's very little academic study about their success, which gave us a place to make a contribution. So speaking of the contributions, on slide 17, our team was able to conduct a systematic review of the Kaizen event body of knowledge. At the time, in 2010, it was at 152. Now we're up to 195 citations. And definitely healthcare is noticeably taking up a larger piece of what we're seeing in the Kaizen event body of knowledge. We identified some critical factors for Kaizen event outcome sustainability based on the academic investigations that were included in that set of 152 citations. And this is a great topic because not only does it include healthcare, but industrial engineering, engineering managers, operations managers are concerned about these issues as well. So it cuts across several disciplines. Moving to slide 18. Slide 18 just shows the research model, so based on some of the literature that we just discussed. Our key question was, what are the critical success factors for Kaizen event outcome sustainability? So there were three sets of factors that we were expecting to impact social and technical system outcomes. The first set were the Kaizen event characteristics. So a lot of these we've already talked about in our discussion of Kaizen events. Were the goals clear? Was management supportive? And so we took the set of characteristics that have been found critical for initial success and wanted to see if they would still be critical for sustained success. Secondly, we collected data on the work area characteristics. So in terms of the work area employees that were in the setting where the Kaizen event or RPIW occurred, what was their propensity for learning and stewardship toward the area? Were they accepting of change in general? And in that work area, were there just changes, so production system changes that were happening anyway after the Kaizen event occurred? Next, we collected a set of post-event factors, and these were factors that related to the extent to which efforts were taken to implement or complete changes after the Kaizen event. So, of course, after an RPIW, you're not necessarily completely done with the change. So if there have been follow-up efforts, for example, 30, 60, 90-day audits or meetings, and how have we been measuring the change over time? And then all of those factors were tested using regression analysis that I'll discuss a little later against a set of sustainability outcomes, so both technical system and social system outcomes. The research design was conducted as an observational field study, so we were collecting data from Kaizen events that were actively happening. Because at the time when we conducted the study, I believe in part, at least, Kaizen events were a little less popular in healthcare organizations, so we actually went to manufacturing organizations for this part of the study. But we have students that are continuing to collect data in hospitals, and that's definitely a passion of mine to continue to collect this data to see if we see similar patterns. We did the work using surveys, so we distributed surveys to usually the facilitator, sometimes the work area managers, to distribute them. So a set of surveys were distributed at the beginning of the Kaizen event, at the end of the Kaizen event, and then we collected data about 9 to 18 months later. And again, these were collected from multiple organizations that all had some form of a systematic Kaizen event program. So this means that they weren't just using RPIWs every now and then, but really had a systematic way of conducting them. So for example, once a month, they would conduct a Kaizen event in a work area, some way of having it systematically done. And usually these Kaizen event programs weren't necessarily called that. So for example, sometimes they were a part of a larger lean initiative or some other improvement initiative. Moving to slide 19. So slide 19 just describes the research methods, and I'll just briefly go over this. So again, at T0, at step 1, we had a kickoff questionnaire that was collected before the event. And then after the event, usually 3 to 5 days later, we collected a report out questionnaire. And these were both collected from the work area employees or just the Kaizen event team. So they could be work area employees and other employees as well. And then at step 3, we collected an event information questionnaire just to get additional details about primarily the performance of that Kaizen event. And then 9 to 18 months later, we prepared another instrument that usually the Kaizen event facilitators, but again, sometimes the work area managers collected data on follow-up mechanisms and work area traits and norms.
Excuse me, Dr. Glover, I don't mean to interrupt, but it seems like someone's phone is not on mute. If you could please mute your phones. We still hear some background noise. Thank you.
Thank you so much.
Go ahead.
And so based on all of that data, we were able to determine whether or not 9 to 18 months after the event, the team was able to sustain or even have increased outcomes, so even greater than 100% in some cases or not. Moving to the next slide, which should be slide 20, I believe. The research methods, so the organizations that we sampled are listed. Again, there were 65 events across those organizations. And if you just bring up everything on that slide, Shiragi, at the bottom, really just describes the analysis process. So we collected the data that I just described, testing for survey fatigue, and just testing for the item distributional properties. Then we wanted to confirm that our constructs were valid and reliable. Most of our constructs were just adapted from other tools that had been used in other settings and already tested, but we also did our factor analysis here, used some categorical principal component analysis for some of the ordinal data that we had, and also used Chromebox Alpha to test for reliability and collinearity. And then we conducted a regression analysis. So basically using that same model that I showed you before, where we were hypothesizing that Kaizen event characteristics, work area characteristics, and post-event factors would predict success or sustained success. And then finally, we tested, used mediation analysis because we were hypothesizing that those post-event factors, so everything that happened after the event, would mediate the impact of the work area characteristics and Kaizen event characteristics on the outcomes. And this was just also based on the literature, primarily the Goodman and Dean model that had been theorized but never tested. So we were hoping to test that theory. Moving to slide 21. So I'll just talk through some of our basic findings very briefly. So the first finding that I'll discuss is an example of a social system outcome. So we were interested in the sustainability of work area attitude and commitment, which described the perceptions 9 to 18 months later, so at T1, of the facilitator or work area manager about the degree to which work area employees liked, their liking for Kaizen events increased, and their belief in the need for and the value of the specific changes targeted by the Kaizen event at T1. So moving to slide 22, the first thing that you'll see are all of the direct effects that we found. So we found that work area attitude and commitment was directly impacted by 3 factors: performance review, accepting changes, and experimentation and continuous improvement. So our measurement of performance review was the extent to which audits and measures were conducted after the Kaizen event, and it had a moderate effect. A greater effect was accepting changes and experimentation and continuous improvement. So these were both work area factors that describe the work area employees. Accepting changes was the extent to which those work area employees were accepting of change after the event, but not only the work area employees, but also the management of the work area as well. And experimentation and continuous improvement was the extent to which the work area employees tended to experiment in general with different improvement ideas, and had a climate of continuous improvement in the work area. And these findings are definitely supported by the literature. And if you go ahead and show everything that's on slide 22, Shiragi, you can see the indirect effects as well. So I'll just briefly describe those. So work area routineness and learning and stewardship indirectly impacted work area attitude and commitment through performance review. And what this suggests to us is, for example, for learning and stewardship, if you have a work area that has a propensity for learning, tend to have a spirit of stewardship toward the work area, then that supports, through performance review, that impacts their attitudes toward commitment to Kaizen events. And then work area routineness would suggest that a work area that's more routine would perhaps have an easier time doing a performance review, and perhaps that's the reason that we're seeing the relationship between work area routineness, performance review, and work area attitude and commitment. Now, does this suggest that we shouldn't do Kaizen events or in work areas that are less routine? Definitely not. But it at least suggests that perhaps we need to think a little bit more thoroughly about how we perform performance reviews in those work areas, and how do we just understand the complexity of work areas that tend to be less routine. And then also, experimentation and continuous improvement and production system changes had an indirect effect through accepting changes. And I'll just briefly describe production system changes. So that would suggest that the more that a work area has production system changes, if we're making changes to the line, changes to equipment, et cetera, then that has an indirect effect on work area attitude and commitment, which makes sense. If you have just work area employees that are just used to change, then they would be more comfortable with the acceptance of changes through Kaizen events as well. Any questions about this finding?
This is Jim Schlosser, Gina.
Hi, Jim.
So, but work area attitude and commitment is then driving something else as part of your larger model, right? This is sort of all the contributing factors to that one attribute, if you will, work area attitude and commitment. Is that how to understand this?
Exactly, yes. So work area attitude and commitment was one of our social system outcomes. So we had, I'll be showing, this was a social system outcome, and then I'll also show the technical system outcome as well. And we wanted to do this in part because, at least in the literature and just in practice, we tend to say that we're not only conducting Kaizen events or RPIWs to achieve actual improvements, so we want to actually see changes and improvements in the work area, but we're doing them to increase this climate and culture of continuous improvement in general. And so that's why we chose work area attitude and commitment as a standalone social system outcome.
But it also, so it really might be the change in work area attitude and commitment, because it's also an input. It's a precondition that then you do your event, and then hopefully your work area attitude and commitment has actually gotten better on some scale. Is that the right way to think about it?
That is a way to think about it. So arguably, yes, and we did see some relationship between, we had a measure of work area attitude and commitment at T0, so immediately after the Kaizen event. And so this is just the T1 results. But we did see a correlation between T0 and T1. Provided that a work area could actually collect data every 6 months for some time, or perhaps every 90 days would be more likely, then we would definitely have, kind of repeated measures to be able to see if we're seeing those patterns. So that would be, ideal, but just very difficult for work areas sometimes to do.
Sure.
So.
Thank you.
Oh, thank you. And then moving on to the next slide, at the bottom it says 24, Shiragi, if that's helpful. I wanted to just describe an example of a technical system outcome. So this is just impact on area. So it's still perceptual, but it's trying to understand the perceptions of the sustained impact on the Kaizen event on the work area. And this is usually where I give my public service announcement of why, unfortunately, we can't necessarily show the objective technical system outcomes, and perhaps a plea for future research researchers. So we found in our collection of 65 Kaizen events that were included in this data set, and also we have a larger set of about 105 Kaizen events, that it tends to be very difficult for organizations to select measures that can be objectively quantified. And moreover, while sometimes it's able to collect that data at T0, it's been very difficult to collect it over time. So for example, I may have a measure of let's just say utilization. For the sake of argument, I might be able to get something very concrete at T0, but perhaps because the facilitator moves or just other changes in the work area, oftentimes we would get an answer of yes or no in the T1 data set. And even with repeated calls, sometimes it's just been difficult to collect that data. So I guess the suggestion that we've given to facilitators, and they've been very receptive of, is perhaps even as in your dashboards or as you're thinking about how are you monitoring your processes over time, to really build in steps for that type of measurement, even outside of a study. I think it would be very valuable to ensuring that really we're achieving the type of improvement that we're expecting. Okay. So moving on to
another question.
Oh, sure.
So I'm curious about the accepting changes variable that you're using. It sounds like that's acceptance by people outside of the original team that implemented the Kaizen changes.
Yes. So it's yes.
So is that not more of a spread issue as opposed to sustaining by the original team? Is that how you see it?
I guess in some ways, yes. So the way that we're measuring both work area attitude and commitment, and thank you for that question. So the way that we're viewing work area attitude and commitment is not necessarily an issue of the team itself. So that's a very interesting point. So we're not necessarily saying that it's up to the team to sustain that outcome at all, but rather that it's an issue of the organization of the work area to sustain that change. So I think by measuring the way that we've measured work area attitude and commitment, we're collecting that data from the facilitators and from the work area managers. And so yes, accepting of changes, we're measuring that as a work area characteristic because at least theoretically it's been found that the work area employees and their propensity toward change, et cetera, would impact the attitudes and commitment toward change over time. Does that clarify?
Thanks for the clarification.
Okay.
Yeah, that clarifies it.
Great, thank you. So I'll go ahead and speaking of acceptance to changes, it is a variable that came up time and time again in our study. So moving to slide 25, we see that impact or accepting changes did have a direct impact on the work area or the sustainability of impact on work area at T1. So this continued to suggest that management's reinforcement of the change, the follow-up task really maintaining that new procedure and being accepting of that change really makes a difference as to whether or not it's perceived that that Kaizen event had an impact on that work area over time. And then having an indirect effect was learning and stewardship. So the more learning-oriented and open-minded that workforce is, would then lead them to be more accepting of change, and et cetera. So, and we found, with an R-square of 50%, which isn't bad, that, this is a promising finding, but definitely to be able to have the data that's a little bit stronger around result sustainability or the objective, quantifiable measures would continue to support this work. So moving to slide 26, and I know we're wrapping up on sustained success. I just have a set of questions, and you could use these at a future time, but these were the items that we had around attitudes, our work area attitude and commitment variable. So, for example, in general, and I've worded it for RPIW, so this RPIW has increased work area employees' willingness to be a part of them in the future, increased attitudes towards RPIWs, et cetera. So, and I can, if interested, and I'll have my email information at the end, perhaps provide our measures or our instruments if people would like to adapt them for their work setting. So just to wrap up our recommendations and future research, we definitely found that continuing, and I know sometimes this is preaching to the choir, but the importance of developing a learning organization and the development of a continuous improvement culture is very important. But I think what's interesting is perhaps it's even more important than some of the technical changes that we expected. So for example, we measured quite a lot on, as a set of, I'm an industrial engineer by training, and so as a set of industrial engineers doing the study, we collected a lot of data about what the change was happening technically, but that didn't tend to be significant in our findings. So at least that suggests for future research, not that we shouldn't continue to collect technical system data, I definitely think we should, but to continue to just see if that pattern holds. What was also interesting were some of the variables that weren't significant. So, for example, none of our Kaizen event characteristics, such as goal clarity, goal difficulty, the heterogeneity of the team, were significant in terms of sustained factors. And this was tested even using the same wording as we used in T0. So this would at least suggest on the surface that we shouldn't necessarily put in too much stock in how we design the Kaizen event, but really to spend much more time thinking about sustainability. And of course, this is something that we can continue to study over time. And I think I've spent enough time talking about just the importance of the accuracy and precision of tracking improvement outcomes. So that's definitely an area of a future study. And then, of course, I mentioned I have one student that's continuing a similar study of Kaizen events within healthcare organizations so that we can have a similar data set, but I think this is very valuable work for healthcare and public health. So we have, I guess, about 7 minutes or so just for any questions and final discussion.
Thank you, Dr. Glover, for a very interesting presentation today, as well as it's a very popular topic, Kaizen events, kind of as a targeting, improvement in different work settings. I know we're getting closer to wrapping up, but we do have about 5 more minutes, so I do want to open it up to the audience to ask questions at this time.
A question? Are you taking them verbally or written?
Oh, verbally is fine.
Okay. I was wondering if, in your research, whether you looked at other variables affecting performance of the Kaizen events, including sustaining the results, impact of the prior level of experience of the teams with prior Kaizen events.
Yes, we did. So in both the initial study and the sustainability study, we collected quite a few variables. One was the work area or the team members' experience, so the people that were on the team, their level of experience, the facilitators' experience, and I think also the leadership's experience. And I believe, if I remember correctly, that, and this was one of the interesting findings, so at least on initial success, we were a little bit better. It was a little easier, I think, for the teams to measure their technical system outcomes objectively and quantitatively at the immediate end of the event. And so we found for initial success that actually team-level team member experience can have a negative impact on initial results. And we expected that perhaps that's related to the fact that if you have so much experience using Kaizen events that perhaps you kind of lose the fresh eyes, right? And perhaps that is why we're seeing some of the negative impact. But it wasn't significant for sustainability, so that's why you didn't see it in this presentation. But I'd be happy to talk about that more offline.
Very interesting. So do you think these results would be equally useful for planning out the next events, the conclusions that you made, for teams that are very new to Kaizen events, as well as those teams that have done a lot already in terms of using these conclusions?
At least from what we're seeing, and again, this is data primarily from manufacturing organizations, so perhaps we'll see some industry differences. I'm not sure, but very excited to look at that. arguably, we would have to say yes. I think but perhaps even, and I think the argument of having fresh eyes on a team, so having this idea that having too much experience could actually be detrimental to teams. So this would say that perhaps new teams even have a leg up on people that have been conducting Kaizen events for quite some time, or as we're just creating team designs, that we would want to have a mix of experiences so that we don't have, everyone on the team has been doing RPIWs for 20 years as an example, but having really a mix of people with that are less seasoned and more seasoned on the team.
Great, thank you. Are there other questions? Okay, then I think before we wrap up, once again, I wanted to thank Dr. Glover for her presentation today and spending the afternoon with us. Before we let you go, I just wanted to introduce next month's topic, which will be Russell Barton presenting on the National Science Foundation. So stay tuned for more details on that. Once again, thank you very much, everyone, for joining us. On behalf of the New England VERC, I'm Chiragi Shah, and have a great afternoon. Thank you.
Thank you. Goodbye.
I met him through